Welcome to NeedyMeds. I'm Mark Allen. We're going to talk about the patient assistance programs that NeedyMeds provides. Our guest is Dr. Rich Sagal. He's the co-founder of NeedyMeds. Dr. Sagal, tell us about NeedyMeds and the website itself. Let's take a look at that.
The website has information on many different types of programs that help people who can't afford medications and healthcare costs. Right now, we're going to talk about the pharmaceutical patient assistance programs. These are programs run by the pharmaceutical manufacturers that provide medications, usually for no cost, occasionally very low cost, to people who can't afford them. Every year, they provide billions of dollars worth of medicines at no cost or very low cost.
And at the same time, you can find out about detailed information about your particular drug right there on the website.
That's right. We list all the drugs, so if you know the brand name, you'd go to the website and click on brand name drugs, or the generic name. We list them both ways. And then you can find out about the program and sometimes programs that help people who can't afford the cost of those medicines.
On the website, does it explain these programs and how they work?
Yes, we go into great detail on many of the programs in terms of the eligibility guidelines, in terms of medications that's provided, how much medication is provided, income guidelines, as I mentioned. We try to give you everything you need to know so you can make a decision as to whether you might qualify.
Can you give us an example of a commonly prescribed drug that is being offered right now?
Well, sure. There are many, many drugs. For example, here's one called Acupril, which is used for hypertension. So if you click on the name Acupril, it's going to open up the program pages that tell you about the different programs for this drug.
And there are literally hundreds of other drugs and companies that are participating in these programs.
That's right. It's totally up to the drug manufacturers whether they wish to have a program or not, what the eligibility guidelines are, etc. But we have all the information on all of these programs, and it's all free, and access is totally anonymous. We ask nothing about the users.
The other thing, there's a calculator on this. How much it's going to cost me?
No, it's the calculator. Most of the time it costs you nothing, so we don't have to do that. The calculator will help you determine where you sit in the federal poverty level guidelines, because all of these programs have some income guidelines. Most of them use the federal poverty level. So we have both the numbers in tables and also a calculator where you can put in your income, family size, where you live, and it'll tell you what percentage of FPL you are.
And at the same time, totally anonymous, as you said.
That's right. So we know nothing about the individuals who come to the website. We get around 17,000 unique visitors most work days. And besides that number, we don't know much about them.
If you want more information about NeedyMeds, I encourage you to go to our website, which is right here on the screen, needymeds.org, or you can call our helpline, and that number is on the screen as well. On our next program, we're going to talk about diagnosis-based assistance programs with Dr. Rich Sagal. For Dr. Rich Sagal, I'm Mark Allen. Thanks for watching.